With psychedelics, we apply a disruptive intervention with which we open a window for psychotherapeutic change.
It appears that these are some of the most effective treatments that we have, much more effective than standard antidepressants and just psychotherapy.
And it is imperative that we offer to the people that are suffering access to evidence-based treatments that are effective. And we do have them now. So this is why I'm advocating for psychedelics.
These drugs we're talking about are mainly LSD, psilocybin, MDMA, also dimethyltryptamine, which is the active component in ayahuasca. Some of people would also classify ketamine or ibogaine as psychedelics. Also 5-MeO-DMT.
Our idea at the moment is to push forward mainly psilocybin for treatment-resistant depression, for example, and also in the future MDMA for post-traumatic stress disorder, because those are probably the two indications and the two substances that are more researched and more developed at the moment. Our role is probably to make it happen sooner, faster and safer, because we really think that if we wait a lot of time for these innovations to happen, there will be lives lost in the process.
We are an organization that wants to make sure that psychedelics are brought to public healthcare systems and to people in a way that is responsible, ethical, driven by science, and that we see in the future equitable access, that people who really need these treatments can have them available, and we hope that this will be also covered by health insurance.
It feels really good to be part of a group in Europe that is trying to bring forth the psychedelic case.
Supporting PAREA made a lot of sense because we see that psychedelics are the new revolution and the new space in which we can definitely see hope coming in.
This therapeutic option is possible in Switzerland thanks to a compassionate use approach. So it's exceptional medical use of a substance that is still an illegal, illicit drug. Actually, Europe could do a lot because it's a possibility for European countries to access directly to illicit substances in a compassionate use way. So there is actually the juridical framework to do exactly what's happening in Switzerland in every given European country. So I would say people should just start doing it.
We are privileged at PAREA to have this 360 overview to see what's happening in many other countries, and we just believe that there is such a wealth of experience and enthusiasm and knowledge there that it would really make sense to put everyone together in the same room, and then the magic happens. So that's what we really did. We brought everyone together, so we have today leaders from 25 countries and almost 30 organizations with us. So I feel like we are really making history with this gathering today. Psychedelic treatments, psychedelic drugs are still, largely speaking, a category that is called investigational drugs. They are still undergoing clinical trials that are supposed to show on large populations that they have a positive risk profile on one hand, and on the other that they are efficacious and then of course cost effective more down the line. So we are still at the stage where they are just, the trials are just kind of passing through late stage trials, which are big trials with hundreds of people. So this is kind of large enough to really give us a solid signal about their efficacy. So this is where the field is, with an exception of ketamine, because Spravato is already approved as the treatment, but all the others are really nearing this finishing line. But a lot of companies in the space are prioritizing the US, and they will be kind of filing for these new therapies and registering them in the US. And in Europe, we see that some countries say, we do not want to wait. We believe we know enough about their therapeutic potential, and we can start already at a very kind of small scale with pilots, make them available for people who have tried many other therapies, but it didn't work for them. So we have Switzerland, who has been doing something that is called limited medical access for around 10 years now, with more than 4,000 people who are already helped. We have the Czech Republic and Germany, who last year introduced early access programs in Germany. It's a compassionate use for psilocybin for treatment-resistant depression, and in Czechia then they rescheduled psilocybin for treatment-resistant conditions, not only depression, it could be maybe alcohol use disorder, maybe anorexia, but of course mostly this will be still depression. And we have a number of other countries and organizations who are here with us in Brussels who are exploring how to engage with their regulators and policymakers to also open up these little pockets of access in their respective countries.
Compassionate use is actually a European program. It's a European regulation of drugs that are in development, that are in clinical trials, but that have not yet been approved. It's for patients who cannot participate in such a clinical trial, and it has to be a life-threatening disease. So if you think about our program, it's treatment-resistant depression. That's, of course, a life-threatening disease. There is enough evidence that psilocybin is working. There are clinical trials running, several in the world. And so that's sufficient to fulfill the criteria for a compassionate use program. It really helped that we had done our study, so we provided all the results of our clinical trial. That was a lot of paper, all efficacy data, safety data to the regulators in Germany. We wrote a treatment protocol which was close to our study protocol. And of course, we could show that we have experience with this treatment, and then it was relatively straightforward to get this approved.
In Switzerland, psychedelic-assisted therapy is legal since 2014 for exceptional medical use of substances that are still considered like illegal drugs. So we can use MDMA, LSD and psilocybin, having a specific request to the Federal Office of Public Health for a specific patient, which must be a person having a treatment-resistant mental health problem. I would say there are already some data on the real-world use of this therapy that at least are comforting us in the safety of it, and also are already showing its efficacy. The demand in Switzerland is still very high. There are only, I would say, around 100 medical professionals that can do psychedelic therapy, so it's still quite a niche.
In 2016, I opened a clinic in New Mexico doing ketamine for depression, and then brought that to Norway. Over the last years, we've been focused on getting generic ketamine approved in the public system, and we did that through health technology assessment through the Medicines Agency, not in a compassionate use way that they recently passed it in France. We very strategically focused on ketamine. Ketamine's already approved, it's legal, it's used as a medicine. What we decided to do was to implement on a national level public ketamine for depression. And by all the infrastructure that you need for any psychedelic-assisted therapy, whether it's MDMA or psilocybin or anything else, it's pretty much the same. So the everything around the process is very similar. As soon as these other drugs come, which they will soon, you can just plug that right into a functioning public health system where people can have access to this for free, which is, what we need.
A compassionate use dossier in Belgium costs 25,000 euros simply to submit. So in July of last year, we managed to secure the funds for a dossier, actually for 2 dossiers. from a single philanthropic donation. So what helped us? First and foremost, starting from a very clear why. And in our case, that was to expand access for patients who do not have time to wait in an equitable and affordable way. By 2025, we already had 2 clinical trials running. And we think this is a key element when you're interacting with the authorities. You want to have the credibility and the know-how already established. The third one was creating critical mass. So we mapped and identified all of the existing know-how within Belgium, all academics, clinical psychologists trained abroad or doing retreats abroad. And we built partnerships with them. So these are really high caliber people who want to support our initiative, people who really want to do something with psychedelics in Belgium. We hope to be able to submit by the 1st of December this year, which means that by the end of March next year, we could end up with a decision on our dossier.
Our main focus is making psychedelics accessible in Ukraine, and as far as right now, it's not allowed to do any research and any medical use of these substances in Ukraine. We have some same situations as probably in a lot of countries. We have some substances listed in a forbidden list, and what we need right now is to reschedule, to transfer these substances to the other list where we can have a kind of controlled use of those substances. When the war started, it started to be clear that the population of Ukraine is highly traumatized right now with the PTSD, with war-related trauma and a lot of other things, including the injuries and the loss on the battlefield. This is not the PTSD, as we say, it's not post-traumatic, it's ongoing trauma. So that's something that makes Ukraine different from other countries right now. And of course, we have to treat a big number of veterans and their families and their family members. We have one of our co-founders, Stanislav Gibadulin. He is a war veteran. He is amputee. What he says that suffering the physical injury wasn't for him as hard as suffering mental problems and this PTSD and its effects. So he tried the therapy with psilocybin, but with mushrooms, just natural ones, and it proved to be very successful. And only one session was enough to cure him, which for him, it's a kind of miracle. And he is open to tell his story, and he did it in a European Parliament yesterday. So we are open and we are talking about those cases because it helps us to advocate. And there are some representatives of Ukrainian government were at this event, some of our MPs and the best professors, European institutions, PAREA and others. And we had a very productive discussion on this. And I assume that we achieved a kind of a milestone where some kind of decision have to be made to allow at least researchers in Ukraine because we desperately need it.
So the state actually in Spain, when it comes to psychedelic research and regulatory development, is changing quite fast. Actually, we're having a lot of clinical research studies being done in the last previous year, and we really hope that in the next years there's going to be much more. In the last year, we have been working very hard to pushing forward the access of these treatments, mostly via the compassionate access program. That is what we want to achieve, and especially we want to build something similar to Germany. So having a program that all hospitals are following the same procedure, the same protocol. That way we can compare the results, we can generate scientific evidence at the same time as we are treating patients that are really in need of these innovations.
The access to psychedelics in Poland for now, it's only in the clinical research. In Poland, we didn't have hippie revolution in the 60s, so basically psychedelics are classified and also seen as dangerous narcotics of abuse. And to change the opinion of the public, we have organized the conference, Psychedelic Science, and we organized this conference in collaboration with the Department of Law and Administration at the Warsaw University. We have also created the first postgraduate studies in Poland about medical potential of psychedelics. And we are trying basically to change the law to decriminalize psychedelics and also to legalize the medical use.
Cannabis and ketamine are illegal for medical use right now. When it comes to other psychedelics, we're a little bit left behind, but we are very slowly catching up. We have our first clinical trial in Athens and Thessaloniki for treatment-resistant depression in 3 hospitals, and it just started this year. So the trial is with psilocybin, and it offers some kind of hope that we are catching up with other developments that are happening in Europe and the rest of the world.
There are 2 access pathways for kind of early access of psychedelic substances. There's a compassionate use, as it is in Germany, where you have to find an institution that gets the permission to do compassionate use program with a sponsor company that is providing the substance. And there is also a named patient use in Austria. The named patient use is a patient-by-patient decision and a patient-by-patient case, and does not need to be connected with a specific sponsor company. Currently, none of those projects are realized in Austria, so none of them is happening yet. So we're trying to talk to authorities, also to stakeholders, how this could be possible to implement.
So in Estonia, we are one of the few countries in the EU that doesn't have any clinical trials running currently. I mean, we are a small country, so we're then also trying to learn from the steps that have been done elsewhere, that we don't have to invent the bicycle ourselves. And right now, what is accessible in Estonia is a ketamine-assisted therapy, but right now in private clinics. We saw the first clinic opening up last year, and it's a brave first step, and which seems to have also motivated the next psychiatrists to open up clinics in different cities across the country. And so ketamine, since it's still used off-label, means that it doesn't have a national health reimbursement. This means that it's still, quite not accessible. It's only for those who can afford it, and right now there's only one doctor who is, doing the therapy, which means, there's a huge line. And so we need more clinics opening up. We need to increase the access.
We have in Brussels all the EU institutions that are legislating, that are deciding about our everyday life in different countries. To some extent, it's also happening with health, certainly with scientific research as well. And so this is why PAREA is really very active and engaging with the EU policymakers. We have European Parliament, we have the European Commission, where for instance, there is a Directorate General for Health, Directorate General for Research. There is a council which brings together all the 27 member states, and they, do a number of different policy files and legislations that are relevant to public health, to mental health, and will be relevant to psychedelics increasingly. There is the European Medicines Agency, of course. So that's where we want to be, and that's where we want to influence these processes.
The PAREA network has been very, very helpful in, first of all, empowering us, seeing that there are so many other countries in the same stage that we are, and we are not alone in, trying to raise awareness and trying to change the legal status of the substances. On a second level, we have access to information and training and resources that we wouldn't have otherwise. So the network can actually help us get where we want to go faster.
We're doing it very well as a team. We're learning from each other, and I think this is the way to go, the way we're going at the moment, like national developments and international exchange, at the same time that we have also contacts and connections with international organizations like the European Medicines Agency or the European Parliament, as we were doing yesterday. All that going in parallel, I think, is the way to go for a faster and especially for a more efficacious implementation of psychedelic therapies in the European context.